Welcome to ContrastConnect, your partner in safe and compliant remote contrast supervision. As a vital member of the imaging team, your role is crucial. You are our on-site eyes and ears, responsible for observing the patient's condition, identifying signs of discomfort, and taking vitals when clinically necessary or directed by the supervising physician. Your communication ensures contrast is administered safely, and any issues are addressed without delay. Remember, your role is to alert, not to diagnose or treat. If anything feels concerning, stop the procedure and immediately contact the supervising physician. Prioritizing patient safety is always the right course of action. ContrastConnect provides the tools and support you need for seamless and safe contrast administration. Some patients are at a higher risk of contrast reactions, especially those with a history of prior reactions, asthma, or other risk factors like beta blocker use. Patients with a known history of severe allergic reaction, anaphylaxis, or airway involvement must be scanned only in a hospital setting, even if pre-medicated or using a different contrast agent. For moderate reactions, such as diffuse hives, facial swelling, wheezing, or hoarseness with normal vitals, switching to a different contrast agent is preferred. Pre-medication may be considered, but evidence is limited. This decision should involve shared discussion with the supervising physician. For mild reactions, like localized hives, itchy throat, sneezing, or eye redness, pre-medication is no longer recommended. If the prior agent is known, switching is the preferred approach. Even with all precautions, breakthrough reactions can still occur, and nearly half of those may be moderate or severe. Always remain alert and prepared to act. It's within the technologist's scope of practice to administer IV contrast as prescribed by a licensed practitioner, using methods like hand or power injection. Informed consent is not always required, but always follow your facility and state guidelines to ensure proper authorization before proceeding. For patients with severely decreased kidney function, defined as a GFR less than 30, additional precautions must be taken. If using iodine-based contrast, the patient should not be scanned in an outpatient setting. The exam must be performed in a hospital. For MRI contrast, scanning may still proceed if the supervising physician has a conversation with the patient about a rare but serious condition called nephrogenic systemic fibrosis. Always alert the supervising physician if a GFR less than 30 is identified, and never proceed with contrast until cleared.